Howdy folks, Lincoln from Garden City Dental here again. Today I'm going to give you the lockdown lowdown on how to manage broken teeth, fillings that have come out or crowns that have come loose. The typical scenarios: you're sitting at home having a nice snack, then crunch, you bite on something hard and realise it's not your food but part of your tooth. Now if you're like me, the first thing you're going to do is swear. I cannot recommend doing this enough. It is great for relieving stress. However, if you are sort of swearing addict like me, you're probably going to find that a single profanity is not sufficient for this scenario. So my first tip of the day, go multiple. And by that, I mean string a few of your favourite swear words together. I can't demonstrate it for you today, but trust me on this, it works a treat. Having completed the swearing, kick the cat, the next thing to do is don't panic. A broken tooth, loose filling, loose crown rarely causes any significant pain. Yeah, the tooth may be a bit touchy with hot or cold, it may be rather sharp on your tongue, but unless you're extremely unlucky, it is not going to cause you a major toothache. So on this model, I have simulated a tooth where the filling has come out and left a cavity. You can deal with this using one of the temporary filling kits you can buy either online from your chemist or in the supermarkets. So here's a typical kit. I bought this from a local chemist today. It consists of 2 pots of temporary filling material and a little plastic spatula to help you apply it. First thing you're going to do is give your hands a bit of a wash. Don't know how many times you've been told to do that recently, but hey, do it again. As you can see, the material comes in the form of a squidgy putty, and you simply dispense a small amount, you don't need much, and fill the cavity with it. So we just pop it in like that, and then you can mold it with your finger or using the spatula. If the side of the tooth is missing as well, then it becomes a little bit more tricky. And once you've packed it in position, bite down on it. That shapes the biting surface. Now this stuff is designed to set very slowly. Once it gets wet, that sets off the setting process, and so best to leave it about an hour before eating, and then you're done. Now if you want to be really professional about it, you can engage in some small talk to yourself just like a proper dentist does. I think you need to bear in mind that you are a dentist, not a hairdresser. So whereas a hairdresser remembers details about you, he has social skills, the average dentist is the very opposite of that. We tend to be sociopaths with absolutely no idea who you are, and our only filter is our dental assistant who kicks us under the chair when we go a little bit too far. Now here, the corner of a tooth is cracked away. This is a very common occurrence, especially in teeth with old fillings. The main problem in this case is often the sharp metal surrounding of the filling. If it happens to be on the tongue side of a lower back tooth, then it can really rub against the tongue and make it quite sore. However, people often say that after a day or so it seems to be less and less irritating. Now in this scenario it's much harder to actually get the temporary filling to stay in position. Again, a moistened finger does help, but often it gets dislodged when eating. If you're having trouble and it's really irritating you, then a simple option is to file the sharp edge with a nail file or an emery board, like so. Don't need to do it a lot. I stole this one from my wife. If you don't have a wife or a girlfriend, then I understand they are still currently available online. I'll try Tinder, eHarmony, or Ashley Madison if you like to share. Keep quiet about your motives, as having a knackered tooth is not generally considered to be a big draw on dating apps. Another option is to mold a small piece of chewing gum over the sharp edge. This can work well for a while, but I would be a little wary about leaving it in overnight, as you don't want to have it come loose and present a choking hazard. Unlike a filling which fills a hole in a tooth, a crown, as you can see, is a cap which covers the tooth completely. Again, if one comes off, it's not likely to cause you a major toothache, but if you can get it back on, then so much the better. There are two main types of crown, one which slots on over the remains of the tooth, like this, and one which relies on a post to hold it in, like this. So give the crown a clean and see if you can get it back on. If you do it right, it will go all the way down when you bite together. If you try it on back to front or side to side, you just won't be able to get it down. What you want to do is you want to practice getting it on and off a few times to make sure you can do it right. Now this temporary putty, it's not great for refitting crowns, as it really is a bit too thick. So what I suggest is that you kind of roll it a bit, try and thin it out, then put a very small amount into the edges, the sides of the crown. Avoid filling the crown completely, like that, and then put it on and push down firmly. Make sure you can still feel your other teeth biting normally. The crown is not stopping you biting. If that feels good, then bite down for a minute or two. If after that the bite does not feel right, it might be better to remove it while you still can and wait until you can be seen. Otherwise, just remove any excess filling around the edges and neaten it up. If you've got a post crown, then it's kind of difficult to use this thick stuff, so in fact virtually impossible. So I'd use something like denture fixative, put a little bit of that on, then cement it back in with that. It will do for appearance's sake, but I wouldn't leave that on overnight because it might come loose and you don't want to inhale or swallow it. Certainly do not be tempted to use super glue. Problem with super glue is it sets almost instantaneously when it comes into contact with moisture, and there's a real risk you get the crown stuck halfway in and halfway out, and that is a big problem. So really avoid that stuff. If the tooth seems to have broken off, you're looking in the crown and literally the tooth is broken off in there, then it won't be possible to stick it back. There's nothing for the crown to grip onto. So in that case, just leave it as it is. If there are any sharp edges, use your wife's nail file just to smooth it down. I'll maybe apply some of the temporary putty just over the edge just to smooth it off and stop it annoying your tongue. It has to be said, these treatments are not ideal. There's a tiny risk that you might even damage a very delicate porcelain crown trying to do this. But currently there is such limited access to emergency dental care that you might feel that it is worth the risk. But hey, if it all goes pear-shaped, please don't blame me, just trying to help. Anyway, if you're patient with the practice, just call in and I'll personally talk you through these procedures if need be. Thanks for listening.